So today guys we are going to start the third chapter of Robbins pathology. The chapter name is inflammation and repair, and we will also give touch to USMLE step 1 and pathoma also. Okay, so here we are going to study inflammation. First of all, we should know about inflammation. What is inflammation? So we have to know about the definition of inflammation. The definition of inflammation is that response of vascular tissue to microbe or injury. Okay, it is response of vascular tissue. So what's the vascular tissue? What's vascular tissue? Vascular tissue, these are arteries. Vascular tissues are arteries, veins, capillaries, okay, and associated tissues in human. Okay, what is vascular tissue? It is arteries, veins, capillaries, and associated tissues in animals. So we come to know that those tissue which are not vascular, because it is response of vascular tissue now, so those tissue which are not vascular, they won't have inflammation. Okay, if a tissue, when any vascular tissue is injured, then there will be inflammation. Okay, those tissue which are not vascular, they won't have inflammation, and those tissue which is vascular and they get injured, then there will be inflammation. Okay, we should know about why inflammation happens. The main concern of inflammation is what's the main concern of inflammation? The main concern of inflammation is to bring the defense mechanism to the focus of injury. Okay, the main concern of inflammation is to bring the defense mechanism. For example, if this is a vascular tissue and this part of vascular tissue is get injured, okay, so the first mechanism that will occur in this vascular tissue will be inflammation. And what does inflammation do? It brings defense mechanism to focus of injury. While what does it do? It removes injured area. It removes injured area. Okay, remove dead cells. Okay, and decreases the cause of injury. It also increases the permeability of blood vessel. Okay, and when the permeability of blood vessel increases, then it allows the migration of fluid, then it does the migration of fluid, okay, proteins and white blood cells, we call them leukocytes. Okay, from the circulation, from where it does migration from circulation to the site of tissue damage. And then it also do phagocytosis. So this inflammation is actually a protective response, okay, that is essential for survival. If there is no inflammation, then there will be no protection, and it will this injured will be gets wear. Okay, it will then convert into chronic inflammation, and that tissue will be die. Okay, so it's called a protective response that is essential for survival. Okay, we will study the sequence which occurs, how inflammation occur. Okay, sequences. For example, the first sequence is that the offending agent, okay, which is present in that for example microbe is injuring that extravascular tissue. Okay, the offending agent is recognized by host cells. Okay, first of all we have to recognize that offending agent. सबसे पहले हमने उस मतलब offending agent को recognize करना है जो injury cause कर रही होगी. ठीक है, जो हमारे बॉडी में होस्ट सेल्स प्रेजेंट होंगे वो रिकग्नाइज करेंगे इस ऑफेंडिंग एजेंट को. फॉर एग्जांपल ऑफेंडिंग एजेंट यहाँ पे था माइक्रोब, सो आवर बॉडीज होस्ट सेल रिकग्नाइज दैट ऑफेंडिंग एजेंट. ओके, देन ल्यूकोसाइट्स and proteins are recruited from circulation to the site where the offending agent is located. Then leukocytes और proteins जो present होंगे ना वो हमारे उस offending agent के पास जाएंगे. Inflammation में ये होता है कि उसमें फिर क्या होगा कि जो हमारे leukocytes and proteins होंगे वो हमारे offending agent के पास जाएंगे. ओके, फॉर एग्जाम्पल इस माइक्रोब के पास जाएंगे. सर्कुलेशन से हमारे इस वेस्कुलर टिश्यू में जो माइक्रोब था, जो ऑफेंडिंग एजेंट था, जो इसको इंजर कर रहा था, हमारे सर्कुलेशन से हमारे ल्यूकोसाइट्स एंड प्रोटीन्स उस ऑफेंडिंग एजेंट के पास जाएंगे. ओके, then these leukocytes and proteins will be activated and these will work together to destroy that offending agent. Then ये दोनों मिलकर इसको destroy कर देंगे. ओके, and then मैक्रोफेजेस भी आएंगे. मैक्रोफेजेस एंड पे क्या करेंगे, उसको फेगोसाइटोज कर देंगे. फॉर एग्जांपल यहाँ पे कोई था, यहाँ पे माइक्रोब था, उसको इससे डिस्ट्रॉय कर दिया, अब उसको ख़त्म भी तो करना है. देन मैक्रोफेजेस कम एंड दे विल डू फेगोसाइटोसिस. Okay, and they also releases mediators that will act on blood vessels. Then also releases mediators and they will act on blood vessels. जब वहाँ पे हमारे मीडिएटर्स रिलीज होंगे, हमारे ब्लड वेसल्स पे जाके एक्ट करेंगे, फिर हमारे जो ब्लड वेसल होता है ना उसके अंदर 2 टाइप की चेंजेस होंगी. वन चेंजेस इज कॉल्ड वेस्कुलर चेंजेस while the second one change is called cellular change. Okay, then हमारे उस ब्लड वेसल्स के अंदर क्या होगी, उसमें लीकेज होगी. ओके, देन लीकेज के थ्रू हमारे न्यूट्रोफिल्स एंड वहाँ से प्रोटीन्स निकलेंगे. न्यूट्रोफिल्स एंड प्रोटीन्स का लीकेज होगा एंड देन फर्दर दे विल डू फेगोसाइटोसिस एंड देन द डैमेज टिश्यू इज रिपेयर्ड एंड एट द एंड डैमेज्ड टिश्यू इज repaired. It's all the we have studied before. These are all the sequences of the इन्फ्लेमेशन. फर्स्ट वहाँ पे क्या हुआ कि सबसे पहले यहाँ पे ऑफेंडिंग एजेंट जो हमारा वेस्कुलर टिश्यू में प्रेजेंट होगा उसको इट इज़ रिकॉग्नाइज्ड बाय होस्ट सेल्स. व्हेन होस्ट सेल विल रिकॉग्नाइज दैट देयर इज एन ऑफेंडिंग एजेंट प्रेजेंट इन वेस्कुलर टिश्यू, देन इट विल सेंड ल्यूकोसाइट एंड प्रोटीन्स. द ल्यूकोसाइट एंड प्रोटीन्स विल कम एंड they will destroy that offending agents and then macrophages will come and they will do phagocytosis and the other function they also provide they also do that they will release mediators. Okay, and the mediator they will act on blood vessels and in blood vessel there are 2 types of changes occur, vascular and cellular changes. Okay, then when on blood vessel, when vascular and cellular changes will occur, then there will be leakage in blood vessels and then from when there will be leakage, the neutrophils and proteins will also release from the blood vessels and they will do phagocytosis and then the damaged tissue is repaired. These are all the sequences we studied shortly. Now we will study each and every sequence in detail. Okay, now we will study that there are 2 types of inflammation. Okay.